Why is health insurance in the USA so expensive in 2026? And why are millions of Americans paying more but getting less coverage? In this video, I'll break down the real reasons and how you can save money. Welcome to Insurance Guide USA, your simple guide to understanding insurance in America. If you want to save money and avoid costly mistakes, make sure to subscribe. Why is my health insurance bill so high in 2026? It is a question millions of Americans are asking themselves today, March 21st, 2026. You open your mail, or maybe an email, and see the bill for your health insurance premium. The number seems to climb higher every year, a relentless upward march that eats away at your budget. You wonder if it is just you. It is not. Year after year, many people pay more for coverage that seems to offer less. This feeling of being squeezed is a shared American experience. The frustration is real, and it is entirely justified. When your monthly payment for insurance rivals your mortgage or rent, it is natural to demand answers, and to feel that the system is fundamentally unfair. My goal here is not to add to your frustration, but to provide clarity. I will break down the core issues in simple terms. The foundation of high costs. The price of healthcare itself. The first and most fundamental reason your health insurance is so expensive is because healthcare in the United States is astronomically priced. Your insurance premium is a direct reflection of these costs. Hospitals charge far more for services. Clinics charge far more for services. Doctors' offices charge far more for services. A simple MRI that might cost a few $100s in France or Japan can easily run into the thousands here. A routine surgical procedure can generate a bill that looks more like the price of a small car. These are not exaggerations. They are the daily reality of American medicine. Insurance companies are the intermediaries that pay these staggering bills on your behalf. To cover these potential payouts, insurers must collect enough money from all their customers. A pool of funds. Every time a hospital charges $50,000 for a few nights' stay, or $10,000 for a diagnostic test, that money is drawn from the pool. To keep it from running dry, premiums rise. Advanced medical technology, highly trained specialists, and state-of-the-art facilities come with a very high price tag. These direct costs form the bedrock of your premium. Consider an appendectomy. In many countries, all in might be $3,000 to $5,000. In the United States, the exact same procedure can easily exceed $30,000, with separate, often inflated line items for surgeon, anesthesiologist, room, OR fee, and supplies. This is fueled by little price transparency and limited effective regulation. In emergencies, you are a captive consumer. Providers hold immense pricing power. They set the prices, insurers, and by extension you, pay them. The hidden labyrinth, administrative waste, and system complexity. Beyond the high price of care, your premium is inflated by administrative cost. The American system is not a single streamlined entity, it is fragmented. Doctors' offices and hospitals employ teams to code procedures correctly, submit to hundreds of plans, and chase down payments. It is a massive, hidden cost baked into every bill. Insurers hire armies to process and scrutinize claims, develop complex software, verify claims, and deny those that do not meet criteria, then negotiate payments with providers. This constant back and forth is incredibly inefficient. It adds expense unrelated to a patient's actual health. In simpler single-payer systems, administrative costs are a fraction of US levels. A doctor performs a service. A coder translates it into codes. A biller submits to your insurer. Software reviews, maybe flags. A human requests more info. Staff gather records. If denied, they appeal. Time, labor, and tech costs roll into your premium. This labyrinth does not make you healthier. It does not improve outcomes. It is pure overhead, a tax on the system. Estimates suggest up to 1/4 of US healthcare spending goes to administrative functions. For every dollar you pay, a significant chunk goes to managing billing and payments, not a doctor's expertise, a nurse's care, or a life-saving medicine. This systemic inefficiency drives the high costs on your monthly statement. Another major piece of the high-cost puzzle is the price of prescription drugs in the United States. Americans pay by far the highest prices in the world for medications, whether brand-name innovations or common generics. Reasons include patent laws that grant long-term monopolies, a ban on the government from directly negotiating prices for Medicare, and complex rebates and middlemen that obscure true cost. When a company can charge $100,000 a year for a new cancer drug, that cost is borne by plans and ultimately by people paying premiums. New high-priced specialty drugs for autoimmune disorders, rare diseases, and hepatitis C place immense pressure on insurers. While miraculous, the price tags can be astronomical. Insurers must account for members needing these treatments and spread that potential cost across all customers. So, even if you only take a low-cost generic, part of your premium subsidizes specialty drugs used by others on your plan. The list price is often not what insurers pay. Rebates and discounts are negotiated by pharmacy benefit managers. Savings are not always passed directly to you and can be absorbed as profit, rewarding higher list prices. Direct-to-consumer marketing drives demand for expensive brands, even when older, cheaper, equally effective alternatives exist. Until price negotiation and transparency improve, rising drug costs will keep driving your premiums in 2026 and beyond. The cost of health insurance is a story of supply and demand has been steadily increasing. Aging Americans, especially baby boomers, need more care, are more likely to have chronic conditions, need surgeries, and use medications regularly. Across all ages, chronic diseases are rising. Managing long-term illness is expensive: visits, testing, and a consistent regimen of medications. Demand for mental health care has increased. Parity laws require coverage, which adds to premiums. We expect the latest tests, procedures, and treatments. Overuse of services and elective, sometimes unnecessary care increase costs. Most insurers are for-profit businesses with shareholders and a bottom line. A portion of your premium covers claims, operations, marketing, and profit. Regulations like the Affordable Care Act's medical loss ratio limit how premiums are used, but remaining profitable shapes pricing. Insurers manage risk with models, set premiums to cover expected claims and buffers for shocks like pandemics or new high-cost drugs. Fraud costs tens of billions annually, from stolen cards to phantom billing. Insurers fund anti-fraud systems. A litigious environment drives malpractice and legal costs across the system. Plan design shares financial risk with you via deductibles, co-pays, and coinsurance. It can reduce insurer spend and discourage unnecessary use, but often shifts more burden onto families. While the systemic forces driving up health insurance costs can feel immense and disheartening, you are not without agency. You can take concrete, practical steps to find the best possible value and lower your expenses. Actively shop around and compare plans every year during open enrollment. Do not simply allow your current plan to auto-renew. Insurers change their prices, networks, and drug formularies. A plan that was good last year might be terrible this year. Use the official healthcare marketplace or a trusted independent broker. Focus not just on the monthly premium, focus on total potential out-of-pocket cost, including the deductible and co-insurance. Honestly assess your health needs. Consider a higher deductible if you are generally healthy. Plans with higher deductibles often have lower premiums. Ensure you have savings for the deductible. Pairing with an HSA lets you save for medical expenses tax-free. Make full use of preventive services covered at no cost: annual physicals, mammograms, colonoscopies, and vaccinations. Catching problems early saves money and protects your health. Be vigilant about staying in-network for doctors and hospitals. Going out of network can trigger astronomical surprise bills. Before non-emergencies, ask about cost. Ask if a generic is available, often chemically identical and cheaper. Consider telehealth for minor issues to save time and money. By comparing plans, choosing the right deductible, using preventive care, and staying in-network, you can assert control and find savings. If you found this video helpful, like and subscribe to Insurance Guide USA. How much are you paying for health insurance in 2026? Share your cost and your tips. Together we can navigate this system more effectively.